Hello there and welcome to the Tech Spot, where we bring you the groundbreaking new concepts in technology disrupting traditional sectors. I'm Uche Okoronkwo. This week, let's explore how tech startups are using technology to greatly improve the way healthcare is now offered across the continent, not just for healthcare providers, but for consumers too. It is no secret that the COVID-19 pandemic exposed huge gaps in Africa's healthcare sector. Experts point to a chronic lack of investment in healthcare infrastructure and equipment and supply chain constraints, which have resulted in critical bottlenecks in the movement of essential medicines from manufacturer to end user. But new research has found that tech startups that are looking to plug these gaps are now springing up all over the continent. According to a 2021 report funded by the Bill and Melinda Gates Foundation, over 60 companies are now using tech-enabled models to change the way health products are distributed in Africa. And this represents a more than 100% increase in the number of companies tracked since 2018. While many of them are still at the early stages of maturity, the report found that at least 30% offer a blend of services and appear to have reached a growth stage. And almost half of them are now operating in both urban and rural areas, reaching over 100,000 healthcare providers. The most active hubs on the continent are Nigeria, Kenya, and Ghana. Well, let's get into how some of these companies are offering innovative commercial solutions to Africa's healthcare infrastructure bottlenecks. Now, during the COVID-19 pandemic, one of the largest barriers to efficient vaccinations in Africa was the lack of storage and delivery infrastructure. In Nigeria, a cold chain technology company called Griquid says that it's now enabling last-mile delivery of temperature-sensitive products such as vaccines, insulin, and even food by using the Internet of Things.
31-year-old Ogenetega Lotim runs Griquid, a solar-powered cold chain technology based in Nigeria's commercial capital, Lagos. The company started in 2019 as a cold chain solution to curb losses in the food chain value. It's now become a viable solution in Nigeria's healthcare sector. The budding tech company has helped convey temperature-sensitive vaccines for COVID-19 and medications across the country, especially hard-to-reach areas.
It's an autonomous cold box, it's solar-powered. So, you can put it on the back of a bike, you can move it to the last mile. While it's in a primary healthcare center, you can plug a solar panel to it and then it charges on its own and then, cools on its own. So you don't need to get ice packs and things like that, but also transmits information, which is what's the storage conditions? Is it between 2 to 8 degrees? Where's the location of the asset as well? Has it gotten to the point where it's supposed to be dispensed? So all that data.
Over the years, Nigeria and Africa's healthcare infrastructure have suffered massive deficits. It's compounded by the outbreak of the coronavirus pandemic. Transporting temperature-sensitive vaccines and medications across the country, especially rural areas, has been challenging. That's why experts laud the efforts of indigenous health tech companies to bridge the gap. However, more loopholes exist.
If we start by saying the use of technology in terms of data management, we're far behind. Just snippets of people who are using it. If you say use of technology in terms of telemedicine, we're not there at all. If you talk about in terms of technology use, in terms of diagnosis also, the key thing here is the vaccine going to maintain the same temperature from the time it is of the manufacturer's listing to the patient. If the tech listing maintains all that, then it will have revolutionized vaccine storage and delivery.
The Griquid infrastructure also fosters business connections that in turn strengthen the economy.
In terms of cold room infrastructure as well, we're able to tell how far are these locations to, maybe farm gates, how far are they to, primary healthcare centers. So even for businesses, new pharmaceutical businesses or new agricultural businesses that are setting up operations, they don't have to part with significant amount of cash setting up infrastructure if they know that there's an infrastructure 5 miles away.
GRICT is also leveraging on data collection to push insurance benefits for businesses. Its collaboration with insurance companies make compensation easier in the event of losses.
For a lot of the businesses or insurance companies that are trying to provide insurance for these businesses, the challenge is things like vaccines, things like dairy products are deemed very risky because of the temperature requirements for them, right? But what we're trying to do is also with the data that we have, could we convince insurance companies to price premiums better? Could we also help them eliminate, fraudulent claims? What we do at GRICT is to help businesses prevent losses. But if they do incur losses, the data that they have should be able to help them, recoup some investments which they've already lost.
And building such technology in Nigeria hasn't been a walk in the park. Health tech startups majorly depend on international markets for their products.
We don't have a lot of industries here that support things like printed circuit board manufacturing or production of enclosures for small units. So you tend to leverage on external markets, right? And that brings me to the second phase. When you now start scaling, you're dependent on an external market, which requires you to have access to foreign exchange.
Africa lost 30% of its COVID-19 vaccines due to temperature excursions. Nigeria's annual agricultural post-harvest losses are estimated at around 50%. For tech experts like Ogenetega, the introduction of more cold chain solutions in Nigeria and Africa is a way out of such wastages.
Now, these health tech apps are not only solving supply chain limitations, they're also using technology to help churn out new models that are serving consumers directly by developing digitally enabled direct-to-consumer tech that can deliver over-the-counter and prescription products. Now, in Kenya, an on-demand platform called Tibu is now connecting people to healthcare workers and also deploying their services to any location in real time.
It is not a typical day for Dora Mombi. It's midweek and the 23-year-old would normally be at college. But today she's getting a home consultation instead.
I had a lingering headache and fatigue for the past 2 days, and so I thought consultation is well overdue.
After telling a friend her symptoms, they recommended that she get in touch with Tibu, a fairly new health app that's slowly revolutionizing healthcare in Kenya's capital, Nairobi. Tibu Health is a digital platform that decentralizes primary outpatient care to bring it directly to patients. It is named after the Swahili word for to treat.
When we first built Tibu, we were just looking at how do we get a practitioner to a patient quicker, cheaper, and more efficiently, and how do we employ more healthcare workers, in the process. We noticed some supply and demand side problems within the health sector. Access to healthcare services was suboptimal, to say the least. And then there was a number of supply side challenges, unemployment of healthcare workers, underemployment of healthcare workers, time to get care, salaries, wages. There was a number of issues on the supply side that we thought tech could solve, essentially.
Now, it takes just a few minutes to upload your details on their website and book an appointment at your convenience. Now, you can't use this app for an emergency, but I can see how useful it can be for scheduling regular checkups, updating kids, or even adult vaccines. And I would imagine that the antenatal package comes in handy for would-be moms. Apart from saving the time it takes to get to a hospital, as well as the cost of transport, by using the model, patients are able to save themselves at least 5 hours of wait time at a traditional hospital.
The doctor, the person doing the consultation, was very professional and tried to be as hygienic as possible as well. So yeah, I have good things to say only. Advantages, obviously, you're not in a waiting room. You just get the service immediately. It's pretty quick and it's not time consuming. And I feel like also the comfort, because sometimes the hospital environment can make you feel anxious or uncomfortable. And so being able to have a consultation in the comfort of your own home is definitely a plus.
Founded in 2018, the cornerstone of Tibu's operations are these medical kits that function like mobile laboratories.
So this first session, we have our vitals, where we have the doctor's stethoscope. We also have a BP machine. We have our weighing scale, temperature, pulse oximeter, and we have our FDA approved EKG, portable EKG.
Upon examination, if it's established that biological samples need to be collected for further tests, Tibu dispatches a rider to pick them up. After the medic collects the patient's samples, the rider takes them to the lab while the medic continues seeing other patients.
When you look at Tibu as a whole, what we're doing is not the normal lab processes whereby any client can walk in and have the test done. Since Tibu is more of home-based and courier services, we get samples from where the client is.
The turnaround time is fairly fast, and hours after sample collection, the patient usually gets feedback.
When we're done with the test, the results we send to our medical team, where they'll be able to reach out to you and explain the reports to you so that you're comfortable with your test and the diagnosis that they'll give it to you.
Studies of similar health service models in the US have shown that in the long run, patients end up paying 45% less for their health care. The eHealth startup has served over 15,000 patients since its launch. It rolled out a comprehensive home-based vaccination service in collaboration with Amref Health Africa. Tibu also launched health packages focused on chronic diseases and secured a variety of key partnerships. Over time, the scalability and flexibility of the Tibu model became apparent.
We started being approached by clinics and other businesses that were saying, hey, are you guys interested in working with us to service our patients with services that we can't currently offer them and that we don't have the capacity to offer them.
According to Fitch Solutions, spending on healthcare was valued at $3.9 billion in 2017. Per capita healthcare expenditure reached $80, of which as much as 61% was sourced from the private sector. Tibu Health wants a slice of this pie. Their services can cost from as little as $17 and run to over $100 depending on the client's needs. The health firm has the capacity to test for over 250 ailments.
We are a registered Class E lab where we're able to do hematology, biochemistry, immunology, microbiology, serology, some rapids here and there.
Tibu's services don't end once they reach out with your lab results. There's the option to have your prescription delivered to you, or one can visit a pharmacy and collect their medication. After a few days, they usually call the client to follow up on the response to treatment, a little personalized touch that is rare in brick-and-mortar healthcare facilities. This eHealth startup wants to improve and employ tech-driven home-based sample collection market, expand its in-house lab capabilities, and expand their services into home-based imaging. The home healthcare provider hopes to continue offering quality, accessible healthcare. They are also pursuing an ISO certification for their lab.
Now, granted, the ecosystem is still quite young, with most companies still at the early stages of maturity and also operating in a single country. While 62% of health tech firms operate in a single country, 38% now operate either regionally or internationally. And while most of them are currently focused on offering consumer services, solutions for healthcare providers, and of course product data services such as inventory management software, and of course counterfeit drug detection, those are slowly picking up pace. But what is interesting is that these firms are increasingly finding themselves competing with brick and mortar health businesses, who of course are now feeling the pressure to develop their own digital channels. But the sky is the limit for these health tech innovators who are reducing Africa's dependence on costly and, of course, limited centralized healthcare infrastructure. And that's where we'll leave it on this week's edition of TechSpot.